Hi everyone, in this video we'll be discussing the LMNOP mnemonic for managing acute decompensated heart failure. So let's start by first discussing what ADHF is. ADHF is the acute worsening of heart failure symptoms. Common symptoms that can tell us this include dyspnea, orthopnea, and edema. And the mnemonic is going to be a handy guide for managing acute decompensated heart failure, and it focuses on interventions to stabilize the patient. So first we have the L. Let me try to draw on this. So the L is going to be for loop diuretics. And we know that loop diuretics, they work by reducing the preload by diuresing the patient. Next up, we have modifying medications. So we want to adjust chronic medications that the patient is on. If a patient has heart failure, they're most likely going to be on beta blockers, and we want to adjust or hold this medication if they have low blood pressure or if they have low heart rate, and we want to continue ACE inhibitors or ARBs cautiously as well. The N is going to be for nitrates. Nitrates are going to work by relaxing vascular smooth muscle, and this is going to cause venous dilation, which is going to reduce preload. And nitrates at higher doses are going to cause arterial dilation, which reduces afterload. And we want to avoid this medication in patients with low blood pressure because of the vasodilatory effects that nitrates have. It can cause significant drop in blood pressure. Next up, we have the O. So if a patient has hypoxia, this can happen in acute decompensated heart failure because of pulmonary congestion and fluid buildup in the alveoli because the heart is not able to pump as well. So there's going to be backup of blood into the lungs. And so we're going to get pulmonary congestion and fluid buildup in the alveoli. So this is ultimately going to impair gas exchange. So we can use oxygen therapy like nasal cannula or non-invasive ventilation like CPAP or BiPAP to improve oxygenation as well as to help with reducing the work of breathing. So if a patient has a SpO2 below 90%, we can provide them with supplemental oxygen. And finally, we have the P, and the P is going to be for positioning. So if we position the patients upright, that is going to reduce venous return to the heart. So as I have in this image, um, if the patient is elevated, if their body is elevated, the gravity is going to cause blood to pool in the legs, and so there's going to be less blood flowing back to the heart, which is going to relieve the pulmonary congestion. So that is the mnemonic that I have. I hope this helps. You can use this when you have a patient with acute decompensated heart failure.